Once again, Leader of the Opposition.
Thank you, Speaker. My next question is to the Premier, but I can assure the government that $1 billion cut from children, community and social services is nothing draft about it. It is real, and it is hurting people today. For over a week now,
Government side, come to order.
Health Sciences North has been struggling with a serious overcrowding situation. Last weekend, the hospital cancelled 6 surgeries and took the step of warning the public to expect longer than normal wait times and to receive care in hallways, closets and bathrooms. They now say that they're on the verge of declaring something called a code orange. A code orange is usually called to deal with community disasters, such as large-scale accidents and occurrences with mass casualties. Wow. But the only large-scale disaster that's hitting Sudbury is the Ford government's disastrous health cuts. Can the Premier tell us why he's making hallway medicine worse instead of better?
Question is to the Premier.
Minister of Health.
Referred to the Minister of Health and Long-Term Care.
Certainly aware that Health Sciences North has faced financial problems over the last several years and that they are working through it with the Ministry of Health officials. We are provided frequent reports about what's going on, but I think it is important to note that we are working on the front lines of healthcare and are investing an extra $384 million for Ontario's hospitals for next year. We're certainly aware that many of Ontario's hospitals are over capacity right now, that they are struggling with placing people in hallways and storage rooms and other inappropriate places. We promised the people of Ontario that we would end hallway healthcare. We are putting that money into hospital operations this year, which should help to ease many of the situations Ontario hospitals are facing, including Health Sciences North.
Thank you. Supplementary question.
Speaker, the government's hospital funding barely keeps pace with inflation, much less growing. Much less the growing needs of a growing and aging population. But that's matched with funding cuts to e-health, to public health, and to health research, all of which means less coordination, less disease prevention, and more patients heading to emergency rooms already struggling with hallway medicine. That's what this government is bringing to Ontarians. The Ford government promised investments to handle hallway medicine, but families are seeing nothing but cuts, cuts, and more cuts, hospitals in crisis, frontline workers getting layoff notices, and more Ontarians in hallways. Why is this what the government is offering Ontarians when they promise so much more?
Minister.
Thank you. Through you, Speaker, I think I need to remind the Leader of the Opposition what we inherited last June. $15 billion deficit that we have to work through. We have to make choices. We went line by line. All of us went line by line through our various budgets, and we are committed to protecting what matters most, health care and education. And in fact, in our budget, we committed to spending $1.2 billion more in public health care. That is to help ease hallway health care, to help promote mental health and addictions plan, to modernize our health care system that we've spoken about many times here in the legislature, to make sure that we can respond to the needs of people now and into the future. We are bringing forward digital health. We are bringing forward a mental health and addictions plan. We are supporting hospitals. We are supporting frontline care. That's what people care about. That's what we committed to doing. We are being responsible stewards of public money, and that is what we're going to make sure that we do for the people of Ontario, because that's what's most important to them.
Order.